Mrs. Princey, Associate Professor in Mental Health Nursing. Today I'll be talking about another childhood disorder which is very much common again. So it is termed as the elimination disorder. So when I say the elimination disorder, basically we have got the two conditions. One is the enuresis and the one is the encopresis. So let us see the elimination disorders. So what are these elimination disorders? These involve the inappropriate elimination of urine or feces. It usually occurs during the childhood or even during the early adolescent period. So this group of conditions or the disorder includes the two conditions. One is the enuresis. So what do you understand by enuresis? It is the repeated voiding of the urine in the inappropriate places. The second one, which is the encopresis, it is the repeated passage of the feces into the inappropriate places. So both these conditions or both the disorders can be voluntary or involuntary. There may be a voluntary or involuntary elimination of the feces or the urine. Sometimes you can note that both these conditions occur together. Okay, almost many of the conditions. So let us see in detail about both these conditions. The first one is the non-organic enuresis. What are the diagnostic features or the characteristic feature of non-organic enuresis? There will be a repeated voiding of the urine during the day, at night into the bed or the clothes. The voiding is mostly involuntary, but at times it can even happen with the intention. This involuntary voiding of the urine occur at least twice in a week for a period of 3 months, consecutive period of 3 months, which can cause a significant distress or the impairment in the areas of functioning such as social functioning, academic functioning, occupational functioning, and also the other areas of the functioning. This urinary incontinence should not be because of any other external reasons. Maybe it should not be because of the use of any other medication or the substances. So this is the criteria that is required to diagnose a child with the non-organic enuresis. Now moving on to the etiology or the reason of the enuresis. Number one, we have got the environmental factor. It includes the delayed or relaxed, toilet training which the child has got, or it can be because of the psychosocial stress or any kind of stress from the environment in which the child is staying or living. Such kind of a stress can also impose the child to develop this, enuresis. The next factor is the developmental and biological factor. There is something called a signaling mechanism which usually matures during the early, childhood period. If there is a problem in the signaling mechanism maturation during the earlier period of the childhood development, then the person or the child may end up with this enuresis behavior. So what is this signaling mechanism? That initiate the dream about water or going to toilet, which usually makes the child to wake up. So imagine the child gets a dream of water or he gets a dream of going to toilet. Anybody for that matter would get would wake up from the sleep and go and visit the toilet. So similarly, this signaling mechanism usually will mature during the earlier childhood period. So some children may have a developmental delay or they may have a lack in the development of this signaling mechanism, which can make the child to develop this enuresis. The next is the genetic factor. It is found that this condition is a heritable one, which can be passed on in a particular family. Another etiological factor is the hormone factor. It is found that the deficiency of antidiuretic hormone itself will cause the enuresis, right? So that is the etiology of the enuresis. Moving on to the second condition, which is the encopresis. So what is the characteristic or diagnostic criteria to diagnose a child as having the encopresis? So there will be a repeated passage of the feces into inappropriate places, especially it can be on the floor or in the bed or into the cloths. It can be involuntarily or the child can intentionally do it. How could you diagnose? At least one such event should happen every month. Okay, in a month, at least one time the child should have this kind of a behavior for a period of consecutive 3 months. Then you can diagnose the child as having the non-organic encopresis. So, what is the age group? Usually, the age group should be 4 years or more than 4 years, because for lesser than 4 years is the time during the toddlerhood period where usually the toilet training will happen. So, if you take the toilet training, by the time the child is 5 year old, the toilet training should have been achieved. But if the child continues to have a problem with this involuntary or voluntary elimination of the urine or feces, then we can say that the child is having the elimination disorder. So this kind of a behavior should not be attributed, or it should not be a contributing one because of the influence of any other medications, use of the substance, or any other condition which results because of constipation. They use a laxative, they may have a frequent involuntary passage of the feces. No. Okay, it should be purely related to a developmental cause. Then you can say it as non-organic encopresis. Now, what is the etiology of non-organic encopresis? The first one is genetic and the physiological cause. The physiological cause can be a painful defecation wherein the external sphincter muscle, okay, the external sphincter muscle will contract rather than relaxing, which will make the person to defecate frequently. So when it is, contracted for a longer period of time, the feces will be withheld inside, right? So because of this, there may be frequent evacuation or defecation which can happen. So the person who is having the problem with constipation can end up with this non-organic encopresis. So use of certain medications which can lead to the constipations are use of cough suppressants or anticonvulsant drugs. All these can lead to constipation, wherein more likely that the child will develop this encopresis. Now, what is the treatment for the elimination disorder? The first thing that we have is behavioral intervention by use of classical conditioning. So here an alarm is used which will give a sound whenever the child will pass the first urine. So traditionally it is called as the bell and the pad technique. So it is nothing but in the napkin or in the pad there will be a bell which will be attached. Okay, so whenever the child will pass the urine, there will be an alarm or the bell will start ringing, or it will produce a sound even if there is a drop of the urine onto the pad. So this makes the child to understand that he has passed the urine, so he has to wake up, take off his pad, change his dress and clothes, and then go back. So that is what is the bell and the pad technique. So that is a traditionally used method. Modern alarms, wherein the simple moisture which the child will experience can also snap into the child's pajamas with a speaker which will be attached to the shoulder. So whenever there is a moisture which is experienced, this is going to give an alarm and the child is going to hear because it is very much attached at the shoulder level. So the child will wake up and then he has to do the care, right? So this particular technique will be used in the child, and by for a period of 4 to 6 weeks, and by the time it is 12th week will the child be able to get used to this kind of a system, and he will stop having this behavior of the elimination disorder. The other treatment we have is operant conditioning technique. It involves the variation of dry bed training. So whenever the child is not passing the urine or the motion, he will be given a reinforcement, positive reinforcement will be given to the child. Like in terms of simple incentives like giving a star to the child, which is similar to a token for the dry nights. So what will be done is you will maintain a particular record of this dry nights. So whenever the child shows the appropriate behavior when the bed is not wet, every time you give a token in the form of a star. So at the end, he can count how many times or how many stars that he has got. So it is a kind of a reinforcement or a reward that the child will get for continuing this appropriate behavior. If the problem is the constipation or impacted fecal matter, then you can also administer the laxatives, enemas, or the lubricant so that it can be evacuated out, so that the problem of encopresis may not arise. Okay, so this is the treatment for the elimination disorder. So elimination disorder is a non-organic one which can happen voluntarily, or it can be involuntarily. Includes the two conditions, that is the enuresis as well as the encopresis. Hope you all have understood the topic. Thank you.